Hey y'all, Dr. Jones here, owner of Wellness Movement, and I wanted to share some research with you. I think one of the most common things I hear is that, doc, my labs keep coming back normal, but I just don't feel well. I've got all these thyroid symptoms, but my labs keep saying normal. So how is that? Well, here is some medical research that dives into this a little bit deeper. And I just wanted to go over this with you. So hypothyroidism symptoms linger despite medication use, normal blood tests. So about 15% of the 10 to 12 million people in the US with hypothyroidism or an underactive thyroid continue to feel sick despite following the standard of care recommended by the American Thyroid Association. Physicians routinely prescribe levothyroxine, a synthetic thyroid hormone, adjusting the dose until the blood levels of thyroid-stimulating hormone stabilize. It goes on to say that despite normal TSH tests, these patients still have many nagging symptoms of hypothyroidism. Patients complain of being depressed, slow, and having a foggy mind. All right. They have difficulty losing weight. They complain of feeling sluggish and have less energy. Yet we doctors keep telling them, I'm giving you the right amount of medication and your TSH is normal. You should feel fine. Now, new research gives these patients who often feel dismissed and forgotten evidence that their persistent symptoms are not just in their head. So this is really interesting. Research conducted by Bianco, published in the Journal of Clinical Endocrinology and Metabolism, found that individuals on Levo had normal TSH levels and were significantly more likely to be taking antidepressants than peers with normal thyroid function. Individuals taking thyroid medication were also less physically active, suggesting lower energy levels. They weighed about 10 pounds more than their peers, even though they consumed fewer calories, and they were frequently prescribed medications to lower blood pressure and statins to reduce cholesterol levels. These findings correlate with what patients have been telling us. The study documents for the first time in an unbiased fashion that patients on levothyroxine feel worse and are much less active than controlled, exhibiting objective cardiometabolic abnormalities despite having normal TSH levels. So guys, what's the problem? The problem is the testing. TSH is actually a pituitary hormone. Thyroid stimulating hormone comes from the pituitary. Research has shown for years that it's not a great gauge of overall thyroid performance. So what do? Thankfully, there's more thorough thyroid testing, and this is stuff that we dive into in my workshops, and if you work with me, we can dive deeper. Instead of just ordering TSH on your blood work or maybe T4 and TSH, there's actually 10 thyroid markers that I like to look at. The really important ones are free T4, free T3. These are the active hormones. And then also, I like to look and see if there's an autoimmune condition. So we look at TPO antibodies and thyroglobulin antibodies, as this is huge. Over 90% of thyroid sufferers actually have the autoimmune form known as Hashimoto's. That's what my wife and mother both have. So again, you've got to test correctly. You've got to dive deeper, and food and proper nutrition and proper lifestyle management is absolutely huge. So I hope this helps. If you want to know more, you can come to my workshop here in Tyler a week from today. Appreciate you watching.